Hi, I'm Dr. Sia, and here on the Dr. Sia channel, we've been uploading some videos on psychotherapy, showing you how people who have certain problems can get help from a psychologist like myself working on problems that are of psychological or psychiatric origin. Now, what is psychotherapy? That's what we're aiming at answering here today. Because I realized I made an assumption when I thought to myself, well, maybe some people don't even actually know what we're on about here and what we're trying to achieve and what is psychotherapy. So here we go. Well, psychotherapy is a place where two people, typically a person who has a problem and then also another person who's a psychologist or psychiatrist or counselor or so on and so forth. There are some roles, many different roles that work with it. Social worker, for example, are doing something called psychotherapy together. Okay, so that basically just means that one person has a problem and they want to deal with that problem, or they have some goal they're trying to achieve. They want to get better, feel better in life somehow, and they're working with a psychologist, a psychiatrist, a social worker, or many other job titles that can be doing psychotherapy. Okay, so if I got any colleagues out there, shout out to all of you and all the different job titles that do psychotherapy. All right, so what is it that we actually do? Well, typically, it means that a person comes in because they have a problem and they haven't been able to deal with that problem themselves. So they need another person, an expert, to help them with that problem. Okay, now why haven't they been able to solve it themselves then? And what is it that we can offer in addition to help that person? Well, the person might not know what caused their problem. Here, a person who does psychotherapy tends to be an expert in finding out what can cause a problem. The person who comes in with the problem might know already what caused the problem, but they might not know what keeps the problem going. Again, psychotherapy is a great place for a psychotherapist, an expert, to help a person find out what maintains that problem. A person who comes in with a problem might know what the problem is, they might know what caused it, they might even know what keeps it going, but now they might not know what a good solution is. And again, psychotherapy is a fantastic place where two people can sit together and figure that out. Now, one of the really good things about psychotherapy is that it's not just a room where two people solve a problem, but the problem keeps going on outside of the room. Contrary to that, evidence shows that what happens in psychotherapy tends to generalize outside of psychotherapy. So what does that mean? It means that what a patient, a client, and a psychotherapists do together tends to then also, the benefits of that tend to also show outside of the room, meaning in the person's life. So whatever happens in the room is valid. It means something. It means something for the person in their life. And if you watch my videos, you'll see that together with the patient or the client, depending on what type of psychotherapist you are, you call them patient or client. But I just use the words intermittently here, or I mix them. So what I'm trying to say here is what you'll see is that I'll be working with different people, helping them solve their problems. Now, you'll also see that they tend to interact with me in that room the same way that they tend to interact with people outside. So let's put this in an example. A person comes in and says, oh gosh, I'm really depressed. And we say, okay, what are the things that make you depressed? What are the kind of things that cause that depression? And they might say, well, I'm not really sure, but I know that one thing that makes me feel depressed is when someone's trying to get close to me in my life. Oh, now that would seem strange because for a lot of people, they would say, well, when someone wants to get close to me in my life, that should make me happy, right? But what if what's going on, for example, in this person's mind is that when someone tries to get close to them in their life, they might be thinking, well, I'm useless or I'm worthless or I'm not good enough. So you'd see over time, they'd start feeling really depressed. So these are the kind of examples that then I can help that person realize, go, wait a second, what's up with those thoughts there? What's going on there? Let's have a look at that. And because what we can do is we can help people change the way that they relate to themselves, but we can't necessarily control the whole world. And sometimes we don't want to. We don't want to make everyone stop trying to love this person. We want people to love this person. What we want is to make it able for this person to also love them back and love themselves. For example, that's just an example. Well, I hope in general that the answer about what psychotherapy is and this little example about how it can be used in and how it then is valid and reliable as a factor that generalizes across a person's life is clear to you now. But let me just summarize that one last time. So psychotherapy is a place where a person comes, sits down, sometimes sits down, sometimes you can stand. I probably shouldn't say sit down anyway. Again, I'm sorry to all those psychotherapists who do standing therapy. But it's a place where typically one person meets an expert. Sometimes it's also group. I should point that out. Sometimes psychotherapy is group psychotherapy, and that's also really good stuff. But so typically, it's where a person comes in, they have a problem, and they see another person who's an expert in dealing with that problem. And the expert, the psychotherapist, can help you deal with understanding what caused this problem, what triggers your problem, what maintains your problem, and ultimately solutions that you can come up with together to how to finally solve the problem as well. It's not just a thing that's about a room and it stays there. The whole point of psychotherapy is that whatever happens in the room actually means something outside of that room too. I hope I've answered some of your questions here. Please put a comment down in the box about what else you would like for me to talk more about. Don't forget to subscribe. Don't forget to like or dislike if you dislike the video. Actually, you know what? Don't dislike. If you dislike the video, don't just forget about had a conversation. Just press like. Press the like button. See you later.